So my name is Lauren Fitzgerald. I'm the Senior Manager of Global Benefits at Circle CI. That's me right there with glasses and maybe 10 pounds skinnier. So I've been at Circle CI for about a year, but I was born in the city, raised in the East Bay. I'm currently living in Oakland. I've been doing insurance benefits for many, many years. As you can see, the second bullet point, I got licensed right after high school. It's a really exciting summer for me, as you can imagine, spending 80 hours in the classroom because you couldn't do it online at the time. I went to CCC in San Pablo and then graduated from SF State. I worked full-time through college, which was miserable, and had maintain a full course load. And then, like most people, I was in retail, stayed in that, kind of jumped around a bit because I was like, nope, not doing insurance. My folks did it, was like, nope, I don't want to do this. This is lame, da 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 da. And nope, ended up getting into insurance. So I do employer-sponsored benefits, which is why I'm here doing this presentation. And silly me, it's exactly where I should have started my career early on. I so much enjoy what I do. I'm a huge, huge geek nerd for benefits. I think it's a really great blend of kind of working with people, kind of a customer servicing, as well as analytics. So if you're into Excel and if you're into math, kind of, and just kind of looking at data and looking at the data and saying, okay, what does it mean? It was a really great path for me. So in terms of what we're going to be talking about, we'll talk about some basics and just one slide, super basics. Basically, I'll just talk about kind of what you should know by the time we're finished. If you don't know this, it's my bad. I haven't done my job very well. We'll go over some common terminology, and if it's okay, Caitlin, at some point I can give you this deck. Okay, groovy. So I don't anticipate any of y'all, there won't be a test at the end. There's a lot of stuff. So hopefully y'all can revert back to this should you need to. We'll talk about employer versus individual coverage, different medical plan types, so like PPOs, HMOs, no OPP, and then FSA versus HSA. And then of course questions. And then like Caitlin mentioned, please don't hesitate to ask questions throughout. I used to hate when people would do presentations and they'd say hold questions and I forget them or didn't make sense anymore. So don't hesitate to ask any questions. So at the end of this, you should be able to kind of understand how insurance works, like my little pyramid. What is employer-sponsored coverage? When can I enroll? Who can I add to my plan? You know, I'm covered in my parents' plan. Does that matter? Lots of questions. I feel like these are more common ones. So you should be able to have the answers to these and have a pretty good understanding once we're finished. So some common terminology. Oof, this is gonna be a slide. Y'all, look at that. Okay, I tried to include all the ones that I thought would come up as y'all explore different plans with different employers, and you're comparing them, or maybe comparing your parents' one that you're on, or whatever, the one that you're on with your school. But I'll just call it a few of them, the ones I think are probably most common. Your benefit plan year, that's when your benefits are effective. So sort of like your school year or any other year, it's typically January through December, but it depends on the organization that you're with, but typically January through December. Your carrier, that's things like Kaiser, Aetna, UHC, United Healthcare, Anthem, Blue Shield. That's the insurance company that you're with. Copay is a pretty common one. That's the dollar amount that you pay when you go in to see the doctor. It's like $30, maybe $50. When you pick up a prescription, that's the dollar amount, that flat dollar amount that you're paying. Dependent, that is a noun in this case, so it's your dependent. So it's a person who's eligible under your plan. So dependents can be, it's your kids. It is not your parent. You can never add your parent to a plan. It's not your grandparents, unfortunately. It's not your siblings. So it's your spouse. If you're in California, it's your domestic partner. There's domestic partner rules that are different in every state, so don't always think that your domestic partner is covered. Some companies require proof. They want to see proof, they want to see marriage certificates, or maybe they want to see your domestic partner affidavit. So keep that in mind. A lot of people try to put their long-term boyfriend, long-term girlfriend on the plan, and some companies will ask you for proof. A lot of them don't, but something to think, you can't kind of sneak around that. Open enrollment, that's halfway down the page. That's your annual opportunity to make changes. So when you start a new company, you of course get to enroll in benefits. Depending on the company, your benefits can start right away. So on your first day, they can start in 30 days, in 60 days, up to 90 days. So it all depends, it's different for every company. But other than your initial enrollment as a new hire, as a brand new employee, you can actually make a change once a year. There's other opportunities, but for everyone gets at least once a year. That's open enrollment where the entire company can make a change. And that is regulated by the government, so that you are required, the company is required to allow you to make a change once a year, and that allows you to re-examine all your benefits. The other time is during a QLE, a qualifying life event. I know, or life event is another one. People don't always say qualifying. And so you can make changes when you have a significant life change. So the common ones are marriage. You get married, you want to add your spouse to your plan. If you get divorced, you want to kick them off. Birth of a child, if you want to. When you add your child, a shift in employment status. So if you maybe, especially during COVID, or as an example, if you went from full-time to part-time, you would maybe lose benefits, or vice versa. Maybe you were a part-time employee, now you're full-time, so you can enroll at that time. Turning 26, so you can stay on your parents' plan until you're 26. Once you're 26, get booted. Now, depending on the company, you might be able to stay till the end of the month. It might be your date of birth that you're out of there. It might be end of the year, but know that around 26, you got to go, and you have to enroll in something else. So that's an individual plan. Hopefully your employer offers coverage. Not all employers do. Then another typical one is your spouse losing their job. So if your spouse had their own benefits with their company, you had yours, they lose their job, they can hop onto yours. And vice versa, if your spouse gets a new job, you can both go onto their plan. So those major life events that y'all might experience that will allow you to make a change. The other ones I'll go over and deeper in a different slide, but I think these are some common ones. So I missed one that's not on here that you are interested in. Let me know, and I'm happy to add it or at least speak to it during this presentation. All right, employer versus individual coverage. So I will caveat this by saying my focus is in employer-sponsored coverage. The individual market is tricky, especially because there's been a lot of recent changes with the new administration. So they've kind of taken away, added things, but at a high level, I'll be able to explain the differences, and only you, for the most part, will be able to determine which one's most advantageous for you, but I can probably steer you in the right direction. So with the employer, companies with 50 employees, full-time employees, have to offer coverage. So if you are with a small employer, or if you're part-time, you may not have benefits, so you might be forced to go to an individual plan, and that's like Covered California, as probably most of y'all are familiar with. With the employer, the monthly cost is split between you and your company. However, they don't necessarily have to pay for your spouse's portion or your kids, but they do have to contribute something. The employer plans is typically, you'll see typically all over this presentation, because benefits is, I feel like I should put an asterisk on everything, because everything is, well, typically or mostly, but typically employer sponsors benefits are going to be less expensive than if you were to go into Covered California. And in this case, you cannot change your plan unless you have a QLE or it's open enrollment. You have that plan for a year. Now, on the individual side, you can enroll at any time, or you can enroll no matter your employment status. So if you have a job, if you don't have a job. Now, you do pay the whole cost. Your employer does not pay. if your employer does pay 100% of one of your plans that's available to you, you cannot get a subsidy. So what's nice about the individual market is they take your income and they determine if you can get a subsidy. It's your household income. And if you get a subsidy, that's great. But it all depends on what your employer pays or what your employer offers. So you may owe taxes on things next year if you lie. These are typically more expensive, and they're also, for the most part, typically the benefits aren't as good as if you were to be on your employer's plan. And then similarly, you cannot change unless you have a QLE or qualifying life event. So for the most part, if your employer offers benefits, 9 times out of 10, that's going to be the one that you want to join. If your employer doesn't have benefits, or if you don't have an employer, you would want to look at the individual market. So when you're looking at tiers in terms of metallics, you won't always see these metallic tiers when you're with an employer plan. They don't always align correctly. So for example, Circle CI, the company that I work for, our plans don't have metallic tiers. So there's some companies that do. It all depends on the carrier. It all depends on the plan. Again, this is where typically, but for individual plans, they do have metallic tiers. So the platinum, as you probably guessed, is the most expensive. Bronze is the least expensive. And I found this really cool graphic, or at least I think it's really cool. I was like, let me try to make this myself. I did not do that. So with the bronze plan, it's going to be the least expensive because the insurance is only paying 60% as opposed to a platinum plan, as an example, where they're paying 90%. So it's one way to look at it, again, less expensive, more expensive. Another way to look at it is how much risk you're taking on, because that's what insurance is. It's the same thing as your car insurance. If you have a car, I don't have a car, but if you have a car, it's similar, where you're paying monthly to Allstate, AAA, whomever, Farmers, whatever. And then if something happens, you're covered, they pay for it, right? So you're paying a smaller amount every month just in case. Same thing with your cell phone insurance or any other type of insurance. It works the same way. So if you have, I'll use the cell phone insurance because that's the insurance that I have. So in this case, maybe there's cell phone coverage and it says we will replace, we'll pay 90% of your iPhone cost. But I have to pay a lot more for that coverage, right? Because they're going to end up paying more. They're taking on more risk. On the flip side, like we'll pay 60%. So that means I have to pay 40% of whatever my new iPhone is. It's going to be less expensive. Pretty simple, like when you sit and think about it, but it's a new concept for a lot of people. So bronze plans are going to be less expensive. Platinum plans are going to be more expensive, but they're also going to have the best benefits. So medical plan types. Bless you, I think that was a sneeze. So there's 5 types. I've grayed out 2 of them because they are not very common, not very popular. You might see them, they're really popular in out of state, so out of California with companies. But the ones I'll focus on are the ones you'll likely see, and again, typically, likely, you know what I mean. These are the ones you're going to see most often: the PPO, the high deductible plan, HDHP, and the HMO, which stands for Health Maintenance Organization. So I listed all of what the acronyms are called. You don't have to remember that. No one knows what they mean. But I thought I'd throw them out there anyway. A common HMO before we get started is Kaiser. I'm sure you're all familiar with Kaiser. Kaiser is a very, very popular HMO. There are other HMOs, but Kaiser is obviously the big one here in California and here in the Bay. So the first one's PPO, a Preferred Provider Organization. So in this case, you have benefits that are in-network and out of network, which we'll get to in a second. But basically, you can see any doctor you want, and some part of that cost will be covered. Any doctor, so long as they're a real doctor. You can't, as an example, come see me, I'm not a doctor, and then try to say, oh no, Lauren, she does acupuncture. No, I don't. That wouldn't work. So it's approved doctors, approved medical professionals. You do not need a referral to see a specialist. So that means if you need, I'll use myself as an example. I have really, really bad eyes. And it turns out part of my eye started to, like, one of the fibers in there, I don't know, started to tear. It was one of those things where if it detaches completely, like, you go blind instantly. Kind of an urgent thing. So my doctor had to find me a specialist, and it was an ophthalmologist, not an optometrist, an ophthalmologist. So I could have found whichever ophthalmologist I wanted. I could do a Google search, Yelp it, ask my friends, then my friends would have known. But I don't need a referral. I can go at any time. If I went to my regular doctor and I didn't like what they said, I could go and see a specialist on my own. Copays are available. So again, the copays, those flat dollar amounts when you see the doctors, those are available under this plan. Deductibles, which we'll talk about in a second, and coinsurance are pretty standard. And these are typically, of the 5 plans, the most expensive because they have that flexibility, right? You can see any doctor you want. That's the biggest thing. The high deductible plan, it's exactly that, a deductible that's high. So you do similarly with the PPO, you can see any doctors that you want. There's no referral, but all services are subject to a high deductible. This will make more sense in the next slide, I promise. Deductibles and coinsurance are necessary for things like hospital visits and MRIs. And this is typically one of the, if not the lowest cost plan available to you. An HMO, again, Kaiser's a really good example where, using Kaiser as an example, you go to Kaiser, you're in Kaiser, you can't see any doctor outside of Kaiser, right? So basically you live in that building. Now Kaiser's one example, but there are other examples where they're not necessarily in that same building. You know, there might be one in the next city, but you can only go to ones that are predetermined. You can't go to any doctor you want or else it won't be covered. You do need a referral to see a specialist. So you can't just go and see a specialist willy-nilly like you want. You do have to have a referral from your PCP, which is your primary care physician. That's like your main doctor that you go see. Most services have a copay. So even like a hospital visit would probably have a copay. Deductibles and coinsurance are lower. This one's moderately priced, right in the middle. And Kaiser's obviously super popular and it's very low cost. EPO and POS, those are really, again, really more niche types of plans. They're kind of a hybrid of an HMO. So an EPO is an exclusive provider network in that it's similar to an HMO where you can only see certain people, but you typically have to have a PCP, but you don't always. So that's where the EPO is a little bit different, that you don't always have to have a PCP, a primary care physician. And then a POS, again, only in network, you have to designate a PCP. However, your PCP can refer you to an out-of-network doctor. Don't worry about those too much. You're unlikely to see them. You'll probably mostly see the PPOs, high deductibles, and HMOs. All right, so that was probably clear as mud. So what I have on the next slide is our plans at Circle CI. So to give some context about Circle CI and who we are and all that. So Circle CI is a tech company. Oh, shocker, tech company in San Francisco. Wow. I know, we're real original. So we're a tech company and we are 350 employees in 6 countries. We are mostly an engineering organization. So that means we have to attract engineers, top talent, blah, blah, blah. So our plans are really rich. We have really, really good, great, robust plans. So one thing to note, not everyone has these types of plans. We're definitely not Google. We don't have those types of plans, but for the most part, we have really, really strong benefits. But here are our plans. We have 5 of them. The smaller the company, typically, someone needs to count how many times I say typically. The smaller the company, the more plans they'll have, typically. So we're 350. So we have hella plans. Like 5 is a lot, I think. So in this case, we have a 250 plan. 250 refers to the deductible. So you'll see 250 individual annual deductible. 500 annual deductible individual. When I move my mouse, can you see it? Okay. So we'll go through each of them, and then what I will ask y'all kind of in your own heads is which one you think is the most expensive. Like how would you rank them in terms of 1 through 5? You can do that in your head at the end, and I'll show you kind of where they are, and we'll see if you're right. But with a 250, your doctor visits here, it's $15. That's your copay. So when you see your primary care or your specialist, it's gonna be $15. So I'm gonna switch my, 1 second. I'm gonna stop sharing for a second. I'm looking up, and it's, sorry y'all. And then, okay, that's better for me. Sorry, thank you for your patience. So $15 is your copay in this case. When you go see emergency, it's a $100 copay. Urgent care, $50 copay. So that means day one, you have your benefits insurance, that's what you're paying. Then if you go to the hospital, it says 10% after deductible. That means you're paying $250 first out of your pocket, and then you're paying 10% of the total cost of the hospital stay. So now when you think about 10%, obviously we know how math works. Percentage stays the same, but the dollar amount will change depending on the total cost, right? So if you have a hospital stay in San Francisco, it's likely going to be more expensive than a hospital stay in like Fresno, right? So it's important when you schedule things like your hospital visits. That's inpatient, outpatient. So inpatient means you're spending the night. Outpatient means you had a procedure and then you left that same day. Blood tests, MRIs, those types of things are also typically subject to a deductible, where again, you're paying that $250 out of pocket first and then 10%. You only have to pay that once though. You pay it once and then you're good for the rest of the year. Then you also have your drugs, 10, 35, and 60. So generic, preferred, and non-preferred. Generic, I'm sure y'all are familiar with. But preferred is basically a drug that does not have a generic, typically. And then non-preferred or specialty drugs, those are really expensive drugs. They're usually typically very new. In this case, ours are only $60, but they can go really high. Sometimes a plan will only pay like 10% of a drug. So you're on the hook for sometimes hundreds of dollars. So it's good to check what's called a formulary. And I've included that in the vocab. You'll want to check kind of if you have prescriptions, where they fall in your plan's formulary, and they'll tell you, oh, the drug you're on is a generic or preferred or da-da-da-da, and you can determine what your cost is. And then your out-of-pocket maximum, I kind of refer to this as bankruptcy insurance because it helps you from, yeah, you guessed it, going bankrupt. So that means that's the most, $1,250, $1,250 is the most you'll have to pay in your plan year. And that was an ACA thing, so it's to help you make sure that you don't go bankrupt. So once you hit that, and that includes deductibles, co-pays, prescriptions, once you've paid out of pocket $1,250, you won't have to pay anything else anymore. Everything is free. So again, this helps to ensure that you don't go bankrupt. These are all, if you'll notice, all in network. So in network essentially means your insurance provider, your carrier, Aetna, Anthem, UHC, whomever, what they do is they go out and they talk to doctors and they negotiate rates. So when you go to a doctor, as an example, you'll pay $15 and Anthem will pay the remainder, whatever the cost is. So obviously different doctors charge different amounts. They'll pay the rest. So they have this predetermined plan. Now, if you see someone out of network, so who's not on this contract with Anthem, you're going to be on the hook for more. So in this case, you're paying 10%. Here, you're paying 30%. Now, where it gets confusing, it's very difficult to explain, so I'm going to go slow, is this 30% doesn't really mean 30% of your provider's cost. So as an example, if you go to a doctor that charges $100 for a visit, which is actually really low, so they charge $100, and it says here that you're paying 30%. You're like, cool, 30 bucks, not a big deal, like, that's fine. It's actually 30% of the Medicare rate. I won't go down there. I won't get into that because it's very tricky, and Medicare is very complicated. But basically, you think you might only be paying $30, but you could be on the hook for something like $80. So it's really important to try to stay in network whenever possible. It's really hard for things like therapists, like mental wellness therapists, and for psychiatrists, especially in the Bay Area. So there's not very many of them that take insurance. So you always want to do kind of your homework, call your carrier, figure out what the reimbursement rate is, because it's really not 30% of your provider's cost. And again, that's the easiest way I can describe. Luckily though, if you have to go to the emergency room, if it's a true emergency, your plan will cover it as if you were seeing an emergency room that was in network. Same thing with Kaiser. So if you have Kaiser and you go out of state to North Dakota and there's no Kaiser in North Dakota, you have an emergency, you're covered, don't worry about it. Now, if you go for an emergency for a cold, yeah, that's not an emergency. And you're gonna have to owe a lot of money. So the 500 plan in this case, again, this is our plans, these are exact our plans, works very, very similarly, except in this case, your deductible is $500. Here, your out-of-pocket maximum is $35. So again, that's the amount where you'll stop paying. Everything's covered. So you know that you have that as your kind of a security blanket, as your ceiling. And then you'll notice different stuff for out-of-network. So these are separate buckets. So you'll pay, so if you have in-network doctors, the maximum you'll pay for you is $3,500, but it's a separate bucket if you have out-of-network doctors. So it's not combined, which is a pain, but it's helpful that you still have this out-of-network availability. A high deductible plan is exactly that, deductible, that's high. So in this case, it's $2,700. You'll notice it says 0% after deductible. There's no copays. So here again, all these are copays. Can you still see you can see okay. All these are copays. There's no copays here, and that's because you're on the hook for all of this. So $2,700 is what you'll pay out. So that means if you, again, using my doctor who's $100 as my example, you'll have to go to the doctor 27 times before this insurance company will pay anything. But once you pay that, everything's covered. Then you'll have copays for prescriptions. And then your that bankruptcy limit, as I mentioned, is $3,700. HMOs and Kaiser, again, they're both HMOs, Kaiser and the HMO, so they work very similarly. In this case, there's no deductible. You can see there's only copays. So that's nice. You know exactly what you're going to pay when you're going to go there. There's no co-insurance. So here, when you're thinking, okay, which hospital do I need to go to? Let me call and figure out what the hospital is going to charge, what this is going to charge, talk to your doctor. It's can get a little complicated. But at least here, you're like, oh, okay, cool. $250, $125, got it. It's a little bit easier to understand, but you have to stay in network. So if you have a doctor you like that's not in network, you have to pay all of that out of pocket. So it depends on what you need, and I'll talk later about kind of how I chose my doctors throughout the year, or my plans, because I've had one of each, and what was important to me at the time. Okay, so I've talked a lot. Let me drink my water. So in your head, maybe think about which one's the most expensive, which one's the least expensive. I'm going to they'll be numbered 1, 2, 3, 4, 5. Maybe in your head, kind of think which one you think is which, based on what you see here. And I'll go ahead and, so in this case, the $250 is the most expensive, which is probably what you guessed, because has a really, really low deductible, really low copays. These two I put both those two because they're about the same. The high deductible is very inexpensive, and then Kaiser in this case is also very inexpensive. What I thought would also be helpful is a lot of people don't understand the true costs. This is what it costs. This is the entire cost. This is what the insurance carrier charges for these plans. So in our case, Circle CI does a split between employee and employer, but this is what is on the bill. So in this case, my company pays for all of this, for all of these four, and this one is one that we require an employee to contribute. So these amounts here are the premiums. Just a fancy word for cost is what it is, because insurance just has to do the most. But they're premiums. These are monthly premiums. So something to think about when they're usually in your paychecks. They'll show the contributions on your paychecks, on your pay stubs. There'll be a section. But insurance is expensive, right? Like, I mean, for one person, it's $561 a month for this plan, or almost around $400 a month. That's a lot. When you have your family, it's a lot. It's almost $2,000 in certain cases, or $1,500. So something to think about. Again, these are the total costs. But I think it's interesting to see, because I think we sometimes forget when we go to the doctor and we're like, oh my God, they're charging me $50 to see this doctor. And you forget how much is behind it. But insurance in the United States is very, very expensive. All right. FSA versus HSA. I found this little nifty graphic also. Just like to copy everybody. I thought this is a really good, high level overview of what it is. So an FSA and HSA are tax advantage plans, and they're tax advantage in three ways. When you put money into them, it's tax-free. When you use it, it's tax-free, and it also lowers your taxable income. So in this case, this is money that you're putting away into an account that you can use towards medical expenses. The HSA, so they're a little bit different, and I'll talk about in the next slides, but the high deductible is only for the HSA. The FSA is owned by the employer. So that means when you leave your employer, you lose everything. The HSA is owned by you. So if you move to a new employer, quit, you get fired, whatever, it's still yours. The contributions, there's limits. That's limits on how much you can contribute each year. There are rollovers. So in this case, you can roll over, depending on your employer, up to $500. Otherwise, you lose that money. So you have to plan. HSA rolls over every year. And then accumulation, again, this one accumulates because everything rolls over. All right, that's very, very high level. So here, HSA stands for Health Savings Account. Savings is the key word. You have to be enrolled in a high deductible plan. Some employers call it an HSA health plan, whatever, same idea. But in this case, again, you're putting pre-tax money away for things like medical, dental, vision. I have really, really poor eyesight, so I have contacts and I have glasses. So I like putting money away for those types of things. So I know how much they're going to charge me. I know I spend way too much on glasses, like the frames I want. I'm not going to get like the Target ones. Of course, I want like the Gucci ones that are way too expensive or whatever. Those are like $500. And then of course the lenses inside and all that stuff. So I have to make sure I put money away. And then my contacts are super expensive. So I make sure when I'm choosing my plans, I'm calculating how much I'm going to spend at least on contacts and glasses. And I think about when I go to the dentist, because I swear no matter how much I floss and all that, I always have a cavity. Always. So I try to make sure I'm putting money away for that. What's nice about this HSA plan is that you can make changes throughout the year. So you're not stuck with it. So if you're like, cool, I'm going to put in $500. And then you're like, a girlfriend of mine who needs a root canal, she was like, oh my God, I need to put more money in. So she can make changes, put more money in so that she can use for her root canal. a lot of times employers will make a contribution to this plan, and that's to entice you to enroll in the high deductible plan, because it's usually the lowest cost, but you're taking on more of the risk. Again, with that plan I showed you, it was a $2,700 deductible, so you have to just pay $2,700 out of pocket. But yeah, you can use all this money for all sorts of things: prescriptions, the chiropractor, labs, x-rays. Again, I mentioned dental, vision, all that good stuff. And then everything rolls over. So if you leave the company, it's your money. Circle CI, my company, we contribute $50 per month for an employee and $100 per month for dependents, for employee and dependents, so for a family. So that money I get to keep, or the employee gets to keep, and if I leave Circle CI, that money is still mine. So that's nice. It always belongs to me. Even if I go to another company, I still own that money. Yeah, and you can't use it for plastic surgery. Sorry, y'all. But you can use it for LASIK. I unfortunately can't get LASIK, but if y'all can, you can use it for that. The next one is FSA, flexible spending account. So the other one was savings account. This one is spending account. The idea is the health savings account, the HSA. Savings is you're saving it, it can roll over. Flexible spending account, you have to spend it, you can't save it because you lose it. So similarly, pre-tax in the same 3 ways. You can use it on all the same things. It's a lower maximum, and there is a use it or lose it. So this is where typically your employer will allow for a $500 carryover, meaning so long as you have less than $500 in that account, it'll roll over. If they don't have that, they have a grace period of 90 days, which basically gives you 90 more days to spend the money. But still is use it or lose it. So you have to plan a little bit more for this. I still usually encourage folks to put money into it. I mean, again, lowering your taxable income, you know you're going to spend money on something. If you think about what you're spending, again, the dentist, your glasses, all that good stuff, you should know you have an idea of what you're going to spend, but you can't make changes. So if you're like my homegirl over there who had a root canal and maybe she only put in $100 and her root canal ended up being like $700, she can't make a change. She's kind of on the hook for that. Typically, employers do not contribute to the FSA. Typically, they contribute to the HSA. Again, typically.
There's a few questions about that, if we could cover them. So someone asked, can I open up an HSA if my employer only offers FSA?
So the only way, and I'm going to go back. So you can only enroll in an HSA if they have a high deductible plan. So if they don't have a high deductible plan, you can't have an HSA. So you can't go to that PPO, that first plan on the far left that I showed, the most expensive one. You can't have an HSA. You can't have your cake and eat it too, basically. If they do offer a high deductible plan and they don't offer an HSA, you should ask them to. Request.
And then one more question related. It says, is 500 the maximum for carryover?
In 2021, it'll be, wait for it, 550. But yeah, not a huge amount. And an employer can decide. It's really dependent on the company. They decide if they want to do a 500. We do a 500. Most of the clients I had when I was in consulting. So some of my clients before were Sephora and the Cal Academy of Sciences. Everyone did a $500 carryover, but it originally started off as a 90, that didn't exist. It was only the 90-day grace period, and a lot of employers, maybe they don't know, or they're lazy. They're mostly lazy. So it'll depend on your company, but yeah, 500 is it. I know it sucks.
Okay, so an HSA kind of operates more of like a savings account, like an actual, like if I were to have like a bank account, it almost works like that. And the money in there can only be used for like medical related things.
Right.
Okay. Cool.
Okay, so which plan is right for me? That's always that's the question. Who cares about all this? Which one do I choose? I don't know. So basically what you're having to do is you're having to balance a lot of things. Cost, which is huge. And when you're thinking about cost, you have to think about cost of your monthly cost that you'll incur during the plan year. So what my copays are, what my deductible is, cost, flexibility. Do you need out-of-network doctors? Do you like Kaiser? Are you happy with just being at Kaiser? Maybe you don't need flexibility? Or maybe you're like, no, I like being able to see who I want. I change my doctors all the time. It all depends. So flexibility is an important thing to determine. Also, do you like my graphic? I actually made this one, kind of. And the last thing is benefits. So again, the copays, the prescriptions, maybe if you have really high prescriptions, my mom has a few, but they're all generics. So she's good. Other people have really unique conditions, and their prescriptions are higher. That's something to look into, to look at, again, the formulary list, to see how much it's going to cost. So this is me. This is your girl. So young adult. So I was under 26, and I had an HMO. That's because that was on my mom's plan. I didn't have a choice. So that was on my mom's plan. And so I had the HMO. What I liked about it was, well, one, I wasn't paying, so my mom was paying. Thanks, mama. It was all copays. So I liked knowing I'm going to the doctor, I'm going to pay $30. I already know, like, it was easy. I didn't really care who my doctor was. I was 22, whatever, super skinny. Ugh. Anyway, didn't care who my doctor was and would still see my pediatrician. Yeah, your girl was like 25, still seeing a pediatrician. That's cool. If I need to see a specialist, I was like, oh, it was nice having like an adult, because I know what I was doing. It was nice to have like my PCP, my pediatrician, my primary care physician helping me navigate that. And then I turned 27, and I had to get my own plan. And this was early in my career, so I joined the high deductible plan. One was because, well, I wasn't making very much money. So I was like, well, I'm not paying for this. So the high deductible one was the cheapest plan. And it was a $7,000 deductible. And I had to pay like, I think $50 a pay period. It was miserable. So you can imagine how much the other ones cost. So I was like, I'm not making enough money. I'll just pay this. It's fine. I didn't really have any medical expenses. Where I was 20, 26, 27, I was healthy. Didn't really mind that I had to fulfill a high deductible. Well, again, because I didn't have money, I didn't really have any choice. And then my employer at the time contributed to, not the HAS, there's no HAS, an HSA. The autocorrect killed me. My employer contributed to my HSA. So like, cool, in the event I have something happen, I have this money that I can use that they're giving me. Then now, an established adult, I have a higher salary that I was making when I first started my career, so I can afford a richer, better plan. I'm also really fortunate that Circle CI offers really great plans, and as I mentioned, a lot of them are free. And I like the flexibility. I don't really care who my doctor is. I just want someone who will see me now. That's, I'm in that generation where I think a lot of us are, where we want it now. Amazon has done me dirty, and now I just want things like immediately, right? So I didn't care. I didn't need to see the same doctor all the time and wait 3 weeks. Nope. I wanted to see someone now. So having a PPO that had in-network and out-of-network benefits was really, really great for me. And One Medical, not sure if y'all are familiar, but if you're familiar with One Medical, super popular in the bigger cities, especially in the coasts. There was a One Medical One Medical office in my office building, 3 floors down. And if I had a high deductible, which I did originally, I had to pay $350 to see a doctor. So your girl's not happy. So the PPO, I only had to pay $30. So it really was. And I liked One Medical in this case because I could see them that same day, next day. I have a really, really busy work schedule. So I can't, I need something now. So that was why I chose the PPO now. Then I asked some of my friends, family members, kind of what they chose and why. So we'll go through this a little bit quickly. So this person, 56-year-old female, and I condensed everything, but they have a chronic condition and they see the doctor frequently. So like having copays, their doctor's in network, or else they would have chosen a PPO because they want to keep their doctor. That doctor is important to them. Me, I couldn't care less who I see. But this person, they want that same doctor. They have that relationship. My good friend here, very close friend of mine, he doesn't have any medical expenses. He wanted a cheap plan because he's cheap. And his current employer, unfortunately, does not contribute to an HSA, but they have a previous one that he was able to still carry over, and so he's using those funds. Colleague of mine has a new family. So there's her partner and a new baby. So they have a lot going on. They like the flexibility. She also has a therapist, a mental wellness, mental health therapist that doesn't take insurance. So they wanted an out-of-network plan so at least she can get some of that covered. Friend here, a colleague, they grew up having Kaiser. They really like Kaiser. Everything's in one place. They don't have to think. The pharmacy's there. They're able to email their doctor. He likes Kaiser. That's why he chose an HMO. In this case, this person has a really big family. There's lots of kids. And these are adult kids. They're all around, range from 22 to 25. So things happen, as you get older, of course, and so they meet their deductibles, out-of-pocket maximums pretty quickly as a family. So the high deductible makes sense for them because the employer does make an HSA contribution, so the plan is free, and they get this extra money. Then the last one, my poor cousin, company only offers a PPO in Kaiser, and he doesn't like Kaiser, so took the PPO. Sometimes it is that, like, you don't have much of a choice. In this case, when I was, the previous slide, when I was on the high deductible plan, it's because I really didn't have a choice. And sometimes it's like that. I was paying $50 a month for a $7,000 deductible plan. I didn't have a choice. Well, I did have a choice. I didn't have the money. So sometimes it is like that, where your choices are limited. So in this case, my poor cousin, it's on the PPO. It's more expensive, but in his case, still fairly affordable. And again, he just doesn't like Kaiser.